Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. It's really great to have you with me today. In today's episode, we are going to be diving into the National Board Dental Hygiene Exam, the NBDHE, and talking about case studies. I have found that students struggle a lot on case studies. And honestly, from the beginning of your program, you learn how to do case studies. And case studies are hard. And the reason why it's so important for you to get early exposure and often exposure is because on your board exam, the NBDHE, and I'm just going to read this right out of the candidate guide, there are 150 items, 150 questions involving 12 to 15 dental hygiene patient cases. Now, these cases present information dealing with the adult and the child. They may involve patients of varying types, including geriatrics, adult periodontal, pediatric, special needs, medically compromised, and pretty much any kind of patient that you might have land in your chair. Now, a medically compromised patient is one whose health status may require some kind of modification of standard treatment or special consideration. And you can almost guarantee that this is what you're going to be exposed to when you take your board exam. The patient information is presented by means of patient histories, dental charts, radiographs, and some clinical photography. Now, case-based items address knowledge and skills required in the following areas. And like I said, this is coming right out of the candidate guide. Let me just put my phone on Do Not Disturb. So the case-based items address knowledge and skills requiring things like assessing patient characteristics, obtaining and interpreting radiographs, right? So assessing the patient characteristics, all the basics that you have learned from your first clinical rotation. And it's all that stuff that you learned in dental theory to practice on your assessment. Obtaining and interpreting radiographs, you do radiographic interpretation from the moment you start taking radiology. Think about all that you have to learn when you're taking radiology and then radiographic interpretation as it relates to patient care in the clinical setting. We have you as faculty always looking at how you interpret your radiographs, not only obtaining a quality diagnostic radiograph, but what does the radiograph tell you? And that's the kind of case-based information that they're going to be assessing you on your board exam. Planning and managing dental hygiene care. How are you putting your care plans together based on your assessment? And how are you managing the patient based on what your findings are in both their medical history and their dental history? Performing periodontal procedures. This is like the how, the why, and the what of what you're doing and everything that you've learned as it relates to a specific patient. Using preventive agents. You learn all about preventive agents in every single semester in dental hygiene school. So they will give you information based on a specific patient need. Maybe your patient has a high caries risk or root surface exposure or sensitivity. What type of preventive agent are you going to think about using with that particular patient? And there may be a question that kind of correlates to that. Providing supportive treatment services. What types of supportive treatment do you think this particular patient needs? So I want you to be as prepared as you can possibly be when you're looking at these 12 to 15 dental hygiene patient cases. And there's so much that you can do to prepare yourself to have a successful outcome when you're taking your board exams. Now, the last case-based item is professional responsibility. When you take dental ethics, you learn all about your professional responsibility as a provider. And some of these questions may be geared towards what is your responsibility as a dental hygienist given this scenario with this particular patient. All of this is very important stuff for you to focus your attention on when you are studying for your board exams. Now, what's so great in the candidate guide is that they give you examples. They give you examples of questions that involve a patient. And they show you a patient box, and they'll show you the patient's demographic and maybe potentially their age, sex, and ethnicity, and if they have a chief complaint. They'll also give you some background information about the patient history. Maybe they show up with discomfort in a particular case study, and then they let you know some background, how long it's been since the patient has been seen by the dentist, or some kind of medical condition that's correlated to the situation going on. And it's really up to you to take the information and kind of percolate the information, sift through the information to come up with your findings. Now, I tell students based on the size of the case study that sometimes it's a better strategy if you go ahead and read the questions first and then go back and read the case study. So depending on how many questions there are on that case study, this might be a good strategy for you. Read the questions, go back and then read the case study because things might pop out to you while you're reading the case study that you're like, oh, yes, that was a question that was asked. For example, let me just give you an example because I think I wrote down a couple here to use to give you some support on that. Now, keep in mind, you're going to have radiographs to look at. You're going to have images to look at. You might have a periodontal chart to look at for your patient. But some of the questions might be like, this patient's high blood pressure condition would be classified as which of the following, right? So by reading that question ahead of time and then going back and reading the case study, when you get to the part in the case study that talks about the patient's high blood pressure, you might have a little red flag go up in your head to, pay close attention to that segment of the case study. Or based on the patient's dental and social history, each of the following dietary recommendations would help to ensure that they eat a more balanced diet except one. So that's how it connects nutritional knowledge or caries or periodontal risk with the actual patient's behaviors and some of the things that they indicated on their medical or dental history. These are some of the things that are going to be helpful for you. If you look at the questions that they're asking in the actual case study before you take a look and dive into the case study, that might go a long way at helping you focus on what is important in this particular case study. But you're going to have a periodontal chart to look at. Remember, you're going to have a lot of information to look at and to sift through. There are 12 to 15 case studies and 150 questions. So say you have 10 to 12 questions on each one of these case studies. And it might be something pertaining to their medical history, something pertaining to their dental history, something pertaining to their medication that they're taking, something pertaining to a situation that you got yourself in. That's an ethical consideration with this patient. Maybe this patient comes in with a chief complaint and you have to help prioritize their care plan. All kinds of scenarios. This is all stuff that you are being measured on because this is all stuff that you're learning as you go through the program. So you will be given a periodontal chart with maybe some clinical pictures so that it's as if you are in the chair with that patient. And those are some of the things that help you be successful on some of these case questions. Now, there are some sample case studies in the candidate guide, and I would highly recommend you go through those because what's nice about it is it gives you some sample questions that go along with that. Like, how often should this fluoride rinse be used for this patient? What can we say about this patient's home care habits? And you have the information right there. So it really helps you learn the style of questions, the types of questions that would be asked for a case-based question on your board exam. So I highly recommend that you look at the sample testlets. And the other piece is, in the candidate guide, they also give you some community health questions. And last week's episode, I talked about how community health, I talked about target populations, and I talked about how there's lots of questions on community health. I believe there's 24 items in the candidate guide that talk about promoting health, preventing disease within groups, community programs, assessing populations, defining objectives with your patients, and then analyzing and understanding statistics and applying research results. And so if you have last week's information on community health and target populations, and you look at that program planning episode that I did, and you couple that along with looking at the case-based items that I'm talking about, this is really going to go a long way at helping you be as prepared as you can be for your board exams. And I will say, when it comes to preparing for your board exams, case-based questions, I think I'm not a huge fan of just doing a bunch of sample questions. But I will say that when you look at case study questions and you look at the case itself, and then you look at the questions and you kind of go over the answers and analyze, okay, why is that the correct answer for this particular patient? And then really figure out where your weak areas are. This is one of those situations where I do feel as though looking at sample case studies and doing sample case studies is super duper helpful for you as a student. One of the hardest things for students to do is to translate theory to practice. Number one, because you haven't had a ton of exposure in theory to practice. You've only seen a certain number of patients in your time as a dental hygiene student. And a lot of case-based questions and case study understanding literally comes from experience and time. But knowing where you're at, these case-based questions are created based on you as a student and what the entry-level expectation is. The expectation is that you understand ethical theory and ethical principles and your obligations as a provider. You need to have a solid understanding about situations that go on with patients and how that correlates to your obligation as a provider. You have to have a really good understanding on the real basic fundamentals of medications, how certain medications impact patient health, oral health especially, systemic wellness, and some of those chronic diseases that are interrelated into what we're doing. What are those A1C thresholds? What is the INR threshold? How is this impacting your care and modifications that you have to make when you're treating patients like that? The special needs populations. How do you make alterations to your specific care? If you think about a routine visit with a very healthy patient, any change that you make or modification that you make from that particular situation, that scenario, is a modification. And those are the types of things that you have to have a really good understanding on. I would highly suggest that your little group, your study group that you formed over time, each of you get together with a scenario, a case study, and really talk through all the possibilities of modifications that you would make. Maybe treatment recommendations that you would have for that particular patient and the why behind it. Also, what types of preventive strategies are you going to implement for your patient based on certain things? Does your patient have generalized recession? Does your patient have a high caries risk? Do they have lots of interproximal restorations, or do they have no interproximal restorations? What does it look like? Is there malocclusion? Are things in perfect alignment, or is there overlap and lots of crowding? Are there lots of spaces between the teeth? What does the gingival assessment tell you? And how does that play into your treatment planning, your care planning, and then the outcomes, your expectations for that patient? What's their dexterity level? What's their cognitive level and their health literacy? Oh my goodness. What's so difficult for case-based questions is that it's really testing all of your knowledge, everything that you've learned. And I think that's the overwhelming piece when you think about half of your board exam being case-based questions. But I have to tell you, if I were going to take the national board exam tomorrow, that's probably where I would have my strongest outcome is on those case-based questions. Would I have to go back and study my foundational pieces on radiology and radiation physics and maybe some of the pharmacology impacts? Absolutely. But when it comes to the case-based questions, this is taking your theory and implementing it to real clinical practice. And honestly, most of you, this is where you shine the brightest. You just have to build up your confidence level in tackling these case-based questions without feeling that level of overwhelm. I know that you're perfectly capable of really dissecting these case-based questions. So if you're a student who gets together with your little group, your posse of friends, and you guys study together, what I want you to know before you go in to take your case-based question exam, or even if you're still in school and you know all the faculty are going to ask you case-based questions in your courses because they're preparing you for this exam. Think about where you go wrong when you do a case-based question type exam question. And maybe talk with some of your friends about what their strategies are and how they tackle those questions. Do they do better when they read the questions first and then go back and read the case study? Or do they read each question and then go find that particular bit of information in the case study? Or are they someone that has to read the entire thing? You need to figure out for yourself what helps you successfully answer those questions. For me, I like to read the questions first. It's almost like I'm doing a chart audit and figuring out, okay, what am I looking for on this patient? Where are we at with this patient? Then I go in and I read the entire case study. Then I go back and read the questions again. I'm like, oh, yes, I remember reading that patient had high anxiety and they take medications for their anxiety. And that medication causes xerostomia and they have recession present. Ooh, so that increases their caries risk. What's their dry mouth situation? How's everything looking in there? How's everything feeling? Oh, they indicated they have some sensitivity, right? So all of this information comes at you, but you want to dissect it one piece at a time so that based on the questions that you are asked on the case-based section, you get the right answer, right? That's what the goal is. The goal is deeper understanding of the needs of your patient and taking the knowledge that you've learned over your curriculum and implementing that knowledge into direct patient care. And that's really all they're testing you for. If this person was given this patient with this scenario, what would they do? That's really all it is. And if you can simplify that in your mind and be like, I am prepared, I can do this, I've got what it takes, I can do hard things, I can totally do this exam, and you don't get yourself so ramped up about case-based questions. If you're a person who shines in the clinical setting and that's like your element, that's your place, then case-based questions, those are your jam. You just have to change the way you're thinking about those case-based questions so that you can really wrap your head around the fact that all they're doing is evaluating how you manage your patient in the clinical setting. So for those of you that are about to take your board exams this spring, take a look at the candidate guide. It's never too early to get started on familiarizing yourself with the format of the exam. You know, while you've been in dental hygiene school, that when you are told by your faculty the exact format and what to expect on an exam, and you're prepared for that, that you do better. And there's no difference on your board exam. Same thing. It's just another assessment, guys. It's a big one, right? It has a high stake behind it because that's how you get those 3 letters after your name. But I know that you are well prepared to take it. And if you prepare yourself by doing the same thing that you do for every other assessment, and that is get yourself prepared, be familiar with the format, be familiar with what's on it, and they give you samples and examples in that guide. Take advantage of preparing yourself in that way. It will go a long way at helping you all the way around with, staying calm about it, having confidence about it, and practice with your friends. Have some comparison conversations where you each bring a case study and you go over the bullet points, the details that you might overlook otherwise, so that you can help one another get really good at case studies. I hope this was helpful. My one call to action for you guys is to share this podcast with your friends, like, subscribe, tell everybody about it. I really want to get the word out to as many students as I can, and through your efforts, I can do that. I hope you guys have a great week. I'll see you soon.